everybody for being here.
Amy, do we have a quorum today? I'm not seeing everyone.
yeah.
So I just want to make sure
we
we
do.
have enough.
Yeah, we do.
Okay, thank you.
Thanks for checking. So welcome. First thing, are we able to put the agenda on the screen so that we can take a look at that so that we can talk about some changes?
Okay. Do you have to, Kyle, does Amy have to do like a script, like a call to order according to
Yes.
whatever?
We should call to.
Yes, we should call the meeting to order and do a roll call.
And then according,
Are there statutes, I mean, rules that you need me to say, Kyle? Because I don't have those.
No, there's no specific
I didn't think
rules that
so.
you need to say to, you just call it to order, you're the chair, and then we do a roll call to make sure we have a quorum. And obviously it
So,
needs to be recorded too. I don't know if that
yes,
started.
we
Okay.
got recording going. Thanks, Kyle.
oh, you do?
Yes.
Okay. So good morning again, Amy Ashton Williams. It is 9:03 and we will get called to order. If we could do a roll call for board members, that would be amazing. And I will go first. Amy Ashton Williams, licensed clinical social worker, board chair.
Olivia Borman, CSWA.
Patty Farr, LCSW, and I want everybody to be aware that I do have to leave at 9:15. I'm so sorry.
Nicole Pantley, public member.
Molly Jansen,
Rick Stallis.
LPSW, board member.
Perfect. Troy Stallis, public board member, connected remotely.
And I think that's all of us. Excellent. If we could take a look at the agenda. I would make, oh, maybe not. Do we have that or do I need to present it?
She's working on bringing it up.
Okay.
There you go.
I would make a motion that we change the order that 3B, 3C, the governor's office presentation and the proposed legislative concept, that they be able to present and then move 3A down to 3C.
Mm-hmm.
And that we also add before we adjourn the place for public comment.
Add minutes too.
Oh, yeah. Oh, the minutes isn't on there?
No, because we didn't, this agenda went out before I.
Oh, the minutes. Yeah, y'all have to approve the minutes too from the previous meeting. So, but the governor's office did state that they would do the best they can to get through the presentation quickly, so that if someone has to leave early, they can still be able to express their concerns.
This is Patty Farr. I want to second Amy's motion.
Okay. And Amy, we also need to add the approval of the minutes as 3 from the last meeting. Do you all have that in box? That's in box, right?
Yes.
So let me rephrase. So what I'll make a motion to change the agenda, moving 3B, 3C up, moving 3A to 3C. Before we get to old business, we will review board meeting minutes from the last special board meeting. And then also add after old business, public comment. Did I include everything that we needed to include?
Yeah.
Yes.
Motion to adopt the agenda as described by Chair Williams. Ashton Williams.
Thank you. So all those in favor, I think we do a roll call.
Nicole Panley,
This is-
aye.
Olivia Borman, aye.
Patty Farr, aye.
Troy Gonzalez, aye.
Molly Jansen, I.
Amy Ashton Williams, aye. Okay, so the the revised agenda has been approved. Have folks had the opportunity to look at the board meeting minutes?
Yeah.
Yes.
So I would entertain a motion.
I want to open this really quick because there's
Yeah, so if the minutes need to be edited, you would simply say no and then say what the edit is, and then we'll just do that in the next meeting. So we don't have to do the edits right this second. But you can, tell us what needs to be fixed, and then
okay.
we'll approve next time around.
I just need to open it.
Okay.
Due to our time constraints today, I'd like to make a motion that we just defer approval of these minutes until the next meeting.
Yeah.
I'm really concerned about time
I
management,
want to
to be
second that
honest.
motion.
Yeah, let's do that. I think that's a better idea.
Okay, shall we vote on that then? I seconded.
Yep, all
Molly's
those in
motion.
favor. Yes. All those in favor of deferring the approval of the previous board amendments, say aye.
Nicole Panley, aye.
Olivia Borman, aye.
Patty Farr, aye.
Troy Gonzalez, aye.
Molly Jansen, I.
Amy Ashton Williams, aye. Thank you.
Done.
Let's go to the next part. We have the governor's office here who is going to do a brief presentation, and then we will open that up afterwards for feedback. And I believe I'm struggling on my little tiny laptop. I know that Amy Baker is here. And Amy, is there anybody else?
Yeah,
I'm just
so
not seeing
so
them.
maybe we could do introductions of the governor's office team really quick before we do
Yeah, that
the
would be great.
right. So my name is Amy Baker, and I am Governor Kotek's Behavioral Health Initiative Director. And for the record, I am a very proud social worker. Casey Liddell.
Casey Liddell, I am the Behavioral Health Policy Advisor, one of two at the governor's office. I have been the point person on LC 216, now HB 4083, and also have been working with the Behavioral Health Talent Council. And I'll go over to April.
Good morning, everyone. April Roman. I use they, them pronouns. I'm a behavioral health advisor on the Behavioral Health Initiative team. I'm also the board liaison for the BLSW and MHRA's two boards. So I meet with Ray monthly to connect on agenda items and other board issues.
Thank you so
And-
much for being here.
Yeah, thank you for having us. And I just want to start off. Casey's going to do the presentation, but I just want to start off and say that I apologize about how the communication went here. We thought you all were potentially more in the know than you were, and realized that isn't true. And so we're trying to make up for lost time here, and know that this is not going to be our only opportunity to communicate with you all. And I think Casey's going to go ahead and do a quick presentation on what the recommended bill does and doesn't do.
And do you have those slides ready? And I will just say I'll try to get through it as quickly as possible. I don't know if we'll be able to get through it by 9:15 with where we are now. So I would encourage, I believe it was board member Farr who is having to leave early. Please feel free to reach out to us directly. We can set up some time to speak about this. I know we're planning on getting some time on the board's next agenda as well, but I don't want you to feel like you don't have an opportunity before then to comment. All right, next slide, please, April. So there are four concepts sort of embedded within House Bill 4083. I will talk a little bit about the legislative process at another time because I really do want to get to the meat of the bill so that everybody has an opportunity to talk about that. But the four concepts are streamlining payer credentialing for behavioral health workers, reducing administrative burden, expanding licensing board's ability to serve licensees and protect consumers through some administrative efficiency, and implementing a cross-license supervision to expand access to clinical supervision. Next slide, April. So first part of the bill, we have heard from a lot of people that the process of having to be credentialed through each individual payer can be very cumbersome and prevent people from being able to start working or prevent them from being able to bill for services. So we are working with OHA to create a centralized credentialing process where workers and providers will only have to submit for credentialing once rather than to each individual payer, and then the payers will be able to pull the information they need from that process. This is something that's been done in other states, and we're hoping to get it adopted in Oregon as quickly as possible. Next slide, April. Next concept is that we are going to be sort of embedding in OHA's mission statement that one of their roles is to reduce administrative burden on providers and workers. We're going to be asking them to reach out to providers, ask them for ideas as to unnecessary or duplicative requirements in reporting or documentation or anything like that, and then report back to us and the legislature every 2 years, letting us know what they have done to reduce those burdens and make life easier for workers. Next slide, April. I'll take a little bit more time here because I do think these are the concepts from the feedback that we got that are sort of most interesting to this board and to people in the profession. So in 2017, the legislature moved the Board of Psychology and the Board of Licensed Professional Counselors and Therapists under the umbrella of a new small executive branch agency called the Mental Health Regulatory Agency. HB 4083 would move the Board of the Licensed Social Workers within that agency as well for administrative purposes, aiming to improve efficiency, customer service, and access to resources. This is going to achieve additional administrative efficiencies, allowing boards to share staff skills and experience, pool resource in order to defray future fee increases, and collaborate more effectively on projects such as the new licensing system procurement. Next slide, April. So we just wanted to be clear that under the language and intent of HB 4083, we are not making any changes to the Board of Licensed Social Workers authority, composition, or mission. MHRA will be responsible for providing administrative oversight and centralized service, but otherwise the Board of Licensed Social Workers will continue to operate with the same level of independence that it has today. That is, as I said, both what is in the bill, but also the intent of our office in this bill. We had no intent to in any way curtail the current activities of the board or authority. This section becomes operative on June 30th, 2027. So in the interceding 16 months, there is going to be rulemaking and other opportunities as this is put together to have significant input on the bill from both the board and people throughout the profession. Next slide, April. So the fourth aspect of the bill, the final concept that is included, is that the Behavioral Health Talent Assessment from the Higher Education Coordinating Commission identified a lack of access to clinical supervision as a significant barrier to workforce development. That's something we have been hearing out in the field as we talk to people as well. Prospective master's level licensees need their supervised hours, but the lack of supervisors has become a significant bottleneck. And we've heard particularly for CSWAs, that is a difficulty, particularly in smaller organizations which may not employ an LCSW who can provide that service. HB 4083 would require the boards to make rules allowing for cross-license supervision in both directions from BLPCT and BLSW. The bill does not mandate what those rules have to look like, what the qualifications are for someone to provide those that supervision. That will be left to the boards themselves to determine how they want to, what kind of background training experience they want people to have in order to be able to be a supervisor under this section. And so that is another area where the majority of the actual policymaking work is going to happen at the board level. It is just sort of the end goal that is being pointed to by this concept from the governor. And I see Amy's hand up. I will go ahead and defer to you.
Thanks, Casey. And I just want to jump in here as both as a social worker, but also as a former executive director. Like, one of the things that I have, and we heard from a lot of executive directors around the challenge of finding supervision specifically for CSWAs. And I am personally proud of the social work roots that are born out of anti-poverty and premises and serving community behavioral health, as is the governor and the governor's wife. And from my perspective, we need more social workers in community behavioral health. I know personally, because I worked in it for most of my career, that it's a challenging place to be, but it is the social worker ethos that I think prepares people for that work, and having access to supervision, as you all know, is like critical to one's professional development. And so I think we want to obviously preserve the social work profession, but we also want to give opportunities for folks in community mental health the chance to grow professionally and to increase the social worker mission and principles within community mental health because of how aligned that is with how things look currently on the ground. So just wanted to add that piece in there.
Okay, great.
Next slide, April. So I did want to talk a little bit about the Behavioral Health Talent Council. As I mentioned earlier, this bill did not come from the Behavioral Health Talent Council, although it was inspired by some of their conversations and work. But I know there's some curiosity about that work, and so wanted to just give a little bit of background. Next slide, please. So this is based on the work of a report that was commissioned by the governor from the Higher Education Coordinating Commission to assess the challenges of the behavioral health workforce and centralize sort of years of research that has happened in one place. After that report was completed, the Behavioral Health Talent Council was established to formulate strategies and action plans in order to address the gaps that were identified and the difficulties in supporting our workforce, and have sort of a plan of what we're going to do going forward to make it a better place to work for everyone. The leadership was First Lady Amy Kotek Wilson, Vice Chair Julie Ibrahim from New Narratives, Vice Chair Eli Kinsley from Bridgeway, and Alice Gates, a professor from OHSU PSU. We had 11 providers, 5 educators, and 5 agency directors on the Talent Council. Next slide, please. And I did want to note we had a lot of background in social work on the Talent Council, and I think that informed a lot of our conversations. So for the leadership of the Talent Council, our chair and 2 of our 3 vice chairs have social work degrees and are at least 2 of them still operating in that space. We have a total of 7 people on the Talent Council who come from a social work background. Next slide, please. The Talent Council has been focused on recruitment and retention, licensing and credentialing, and education and training, which are the 3 subcommittees that have been submitting recommendations to the full Talent Council. We have crafted action plans, which will be incorporated into a plan that will be published at the end of January, so coming up very soon here. The legislative concept is going to outline statutory changes, not just for the next legislative session, but probably some bigger changes in the 2027 long session, as well as executive level actions that can be taken in order to implement the recommendations of the council. Next slide, please. And so just before we open things up, just wanted to echo what Amy said, where we really, the input of both the Board of Licensed Social Workers and the community of social work professionals is incredibly important to our office. We know that we did not, we had some communication breakdown in terms of creating the pathways for you to feel like you could get that feedback to us, and we are determined to make sure that we fix that and are able to partner and collaborate with you on the work going forward. So as I note here, we're soon going to have the Behavioral Health Talent Council full report. There's going to be a lot of work to do to implement some of those recommendations that are going to make life better for the behavioral health field. And so we are looking forward to partnering with the board and everyone in the field in the implementation of those. We're also looking forward to working closely with the board on the implementation of House Bill 4083, including planning for the move and also the rulemaking for the cross-license supervision, and continuing sort of conversations about concerns and opportunities that might happen throughout that process. So I believe we're asking that we can come back at the next board meeting as well, because we imagine there are going to be continued conversations about these things. We would certainly love to have the board's support for House Bill 4083 once we've had a chance to answer questions and sort of talk through what's in the bill. But I think for the time being, we want to leave as much time as possible for the board and for the members of the public who are here to be able to present their comments and feedback.
Thank you, Casey. Amy and April, was there anything else that you were hoping to share?
No, I just want to reiterate what Casey already said. Like, this is sorry, this is not our last conversation. Would be happy to come back to the next board meeting to continue the conversation, and just want to hear what you have to say.
April?
Thank you, Amy. I just support for what my colleagues have shared, and just want to make myself available to as a point of contact for the board to make sure we're communicating with the rest of the initiative team and through the talent council work as that moves forward as well. Recognizing those are separate things. We have a bill in the short session and we have the work planning of the talent council going forward, but there will be opportunities for us to help facilitate and check in on implementation or ideas about implementation along the way.
Okay. Could I ask for the next part of this that we take the slides down so that we can see? I'm not sure who's sharing. I'm so sorry. Thank you. I wasn't sure who was sharing. Thank you. I appreciate that. And so we'll, if you guys are feeling good, we will move on for the board to ask questions, have comments. And Molly has her hand up, so you're on.
I guess before we even ask any questions or provide any feedback or comments, I guess I would like some clarification on what really is the reality that our feedback is going to be heard, because I have two concerns up front. One is there wasn't a communication breakdown. There was just no communication. There wasn't even an effort to get accurate information from our staff. So it wasn't just the board was never communicated to, the staff was not reached out to make sure that accurate kind of data was utilized for these recommendations. So I just want to clarify that. So I don't have a lot of faith right now. And nothing frustrates me more than performative inclusion. So if you are not really going to hear our feedback and potentially make adjustments to this bill. I'm not quite sure what the point is. And then and part of that is the second part of the concern is I'm hearing kind of conflicting messages from the governor's office from you all right now around, we're open to hearing your feedback. We want to hear, your feedback, but around implementation. So not about the actual bill itself. And so I would like a very clear answer on whether or not this is feedback about the bill or feedback about implementation.
I think that we're hoping for feedback about implementation, because it's pretty wide open. I think, and my understanding is that the Board of Licensed Social Work was already working on a cross licensure supervision structure.
It's been in place for a while, actually.
Yes, and then in terms of like the Board of Licensed Social Work, having the administrative support of MHRA. What we believe, so again, my experience is that when you have small organizations, the administrative tasks of those small organizations are so much harder to implement, because you don't necessarily have the staffing to do that. And so that action really is, and we're not looking at, it will be a process that it would go through DAS to figure out how to do this. But really the intent is to improve how the Board of Licensed Social Work functions, because they would have more resources to do so. So again, like that's more about the administrative piece of like functioning under a government bureaucracy. It is in no way intended to reduce the authority and the directive of the social work board mission and purpose. And so I guess I would ask, in terms of like those two pieces, like what are your concerns about that?
Nicole, I see your hand, so I'm gonna let you go.
She's muted.
You're muted,
We can't
Nicole.
hear you.
It's my favorite thing to do. So you're saying that the Board of Social Workers, that with smaller agencies, that we may require some support or help administratively. So was any workforce analysis conducted to determine whether the mental health and regulatory agency has the capacity to absorb what I thought was the largest board, the Social Worker Board? I could be wrong.
April, can you speak to that?
Sure. Yeah. So I think this speaks a little bit to what we've heard as maybe one of the misconceptions about the policy. We're not looking to put the administrative capacity under existing administrative capacity. We're looking to combine the BLSW's current admin support under MHRA's umbrella. So we would not be losing staff capacity, but we would be gaining the efficiency of being able to put that full team together. So I've heard that as a concern. In terms of what informed this decision, I think, MHRA was founded in 2017. It provides administrative support to the Board of Psychologists and the licensed therapists. And we've been looking at monthly reports in terms of license processing and data regarding like investigations and other things that are the responsibilities of the administrative piece of the board. And MHRA has been able to provide a lot of improvements and support for those boards. And we're hoping and intending for the MHRA to provide the leverage capacity to be able to provide more efficiency for the social work board as well.
And I do just want to point out that it then stretches the MHRA executive director even further, rather than focused as our executive director currently is. which doesn't position the Oregon Board of Licensed Social Worker as well as it would have be like currently, right? We currently have an executive director that is very focused on social work. With this move, it would stretch then MHRA's director to all like licensed professional counselors, LMFTs, psychologists, and social workers, which is huge. And so that when I think about like that capacity and what Nikki was asking, I'm like, was that considered in looking at expanding workforce? Because now we have an executive director who is spread super thin.
If I can hop
I
in with a
also just wanted
response
to-
to,
Oh, I just wanted to add because I know we have some public folks, the MHR currently oversees like close to 5,000 licensees, and the Board of Social Workers currently oversees almost 10,000 licensees. So that would be like a 200% increase in the number of people.
yes, I just want to respond to what Amy just shared as just confirming, yes, that would be a single director. But we are, like I said, anticipating that the staff would provide additional support. So underneath a single director, we would have the ability for more people to be able to separate teams that are like one team for investigations, one team for new license processing, and having more oversight of that with the additional capacity. And, you know, I understand that it would be a bigger number of licensees to serve. And we definitely considered how best to leverage the resources that we have. I mean, recognizing that these boards are funded by the fees of
We have
your
to do public comment
constituents.
afterwards.
Sorry, was somebody hopping in?
No, I think Ray was just helping a public member.
Oh, okay. Yeah. So recognizing that, you know, there are fee-based fees as revenue for supporting the administrative capacity of these boards, and thinking about the best way to leverage and limit that what fees may be coming back to support more capacity to be able to provide the oversight and functions that the board needs to do. There are some real public administration concerns around our ability to serve board members, or the licensees, and the people we serve ultimately. So we want to be able to leverage as what we can. And that's sort of what Amy was talking about in terms of the public administration role side of that piece of the bill.
Yeah, Nikki.
I'm just kind of curious what data, where is this information coming from? So where is the information that shows that the Board of Licensed Social Workers' current structure is contributing to not only this administrative burden or licensing backlogging, but workforce shortages? And then the other concern I have is that while placing this all under one executive director, there's specific functions that an executive director must do on his own. And so one of those is interpret the board's statutes and administrative rules. That's a lot for all of these different boards.
Yeah, and again, like I think I hear the concern that the kind of the unique aspects of the Board of Social Workers will get lost in a bigger organization. And I can assure you, like, that's not something that we would let happen. Like what I think it does, and is it makes the functions of a smaller organization more effective as you combine functions. Like I think social workers are going to probably get better. They're going to get better service, which is the the goal of the governor was really to try to reduce all possible barriers to ensure that people would get licensed quickly, that investigations would happen timely, and that we don't want and this is not like a reflection of Ray, it's a reflection of the fact that the administration is just really small, and it's it's hard to run an organization that has like all of the tasks, but you don't have any of the economy of scale when you have a smaller organizations. And so, and the economy of scale, meaning that more specialization when you have more staff who can focus on a specific area.
Can someone address Nicole's the question? Nicole, I don't know if you need to restate it, but I think that was important.
So mine is where did you get the information that the current board structure is contributing to slow licensure, workforce shortages, or administrative burden?
I'll just clarify that the board, we aren't implicating that the board is contributing to that. We have concerns about the administrative capacity of the admin side, the BLSW admin side. And I think, you know, as I mentioned, we get monthly reports on license processing. We have also checked in with, as I said in my introduction, that I meet monthly with the board EDs and been talking about backlogs on things like investigations. Well, when the governor took office, we directed the board staff to prioritize processing new licensure, and at the cost of that is that we've noticed that their capacity for addressing other things like looking into complaints and investigations has been affected by that. When talking with the ED about how to address that issue, he has cited repeatedly that he doesn't have the capacity. And so we went forward to bring fee increases to try to address that. We've given one-time funding to the Board of General Fund, which is outside of the fee-driven budgeting, to try to address it, but it's one-time funding, right? And so we have increased a fee. We have to try to bring more resources to the board. But at the end of the day, looking at the capacity needed to serve as many licensees as you all have, this was an administrative decision that the governor thought that will bring that more capacity to the licensees.
Molly?
I'm actually going to defer to Olivia because Olivia hasn't had a chance yet.
Thank you.
Just gonna acknowledge what you've said, April, around this coming out of your conversations with Ray as part of this, but also wanting to name again and reiterate what Molly said about like not a communication breakdown, like just wasn't communicated with us. And that even in sitting here, it's like y'all are telling us what would be better for us. And that just wanting to say that that's really frustrating.
And I do have to include the Board of Licensed Social Workers never received general fund. But I just want to be still clear on that one.
Sorry, Ray, I must have misinterpreted that. Then we had one-time funding that came to bring you LDA staff, right? Limited duration staff?
No, we never received any general fund for anything since I've been on the board, nor when I went back through the records to even look to see if the Board of Licensed Social Workers ever received any general fund. I'm not finding that. Now, there was some funding that was through OHA to cover licensing fees before I got here, but there was a request for general fund for a licensing system, and we never got those funds. That didn't go through the legislature.
Before you, and I'm happy to follow up with more specifics, but before you joined as ED, there was a limited duration staffing that was funded to support the backlog, getting through the backlog of new applications. But
I think this actually brings up a really important context that we're hearing, which is many of the issues and the challenges were prior to Ray coming on. And what is absent in this narrative is the work that's been done by the staff with Ray since Ray has come on, that the inefficiencies and the legs and kind of following through with things have actually significantly been addressed not only in a way that acutely addresses them, but in a way that's sustainable so that we never end up back in that place again. And I think that honestly is a little bit about where the board is coming from, is that feels really disrespectful. And that it feels very intentional that that larger context of Ray, and I mean, without acknowledging, and I do want to acknowledge brief, there was an interim director who also started the work, but Ray picked it up as the permanent executive director and then really carried it forward. And so I think that is not being acknowledged here at all. And that's deeply concerning, that you're fixing something that already is being fixed in a way that's sustainable, but yet there's silence around the things that we have said. You know what would really make things more efficient? A portal that actually is functional both for our CSWAs and our supervisors and our staff. It's not. We've been asking for that since the previous permanent executive director. There were some issues in leadership there, but I don't want to get into that. But so, I mean, you haven't been listening, and maybe the funding hasn't been there, but also Ray and the staff should not be held accountable for that, for the efforts that they have put in to make things more efficient is already being experienced. We don't have the legs in getting licenses processed. There is still a little bit of a backlog in investigations, absolutely, and they're also down a staff in terms of an investigator who, like, even prior to that person leaving, the workload was landing on the rest of that team. None of that is existing in any of your narratives. So the governor's office saying that they're assessing that these things, are barriers. Yes, they were. And there has been so much work done already, and it's done again in a way that is not about like fixing it with a Band-Aid, but how do we sustain this ongoing? And that's a lot of the concern. And I'll be honest, I have lots more to say. We don't have time, and I do want to be respectful of, and I want to hear from public members as well. So I'm just going to say, I'm not going to raise my hand again, but I don't want that to be interpreted that I don't have more to say.
And I'm sorry, I know we want to leave space for public members. I just want to respond to Josh Leiden's comment in oh, sorry, never mind. I misread that. I'm not going to respond to that. Next public comment.
Before we move to the public, Nikki, was there anything else that you or other board members wanted to ask?
Yeah. I just wanted to say that thank you for including us, the Board of Licensed Social Workers, at this stage. But I do want to bring to light that true inclusion means being consulted early, having access to the same information as others, being able to raise concerns and having those concerns addressed, and having a real voice in shaping this, like a final decision like this. When those steps don't occur, people are not meaningfully included in decisions. And I appreciate that we're being brought in now, but I just have to say that.
Thank you.
And just to respond to that, like, we hear you loud and clear on that. We are definitely hearing that.
Were there other questions from board members?
I don't have a question, but I do want to make sure there's a lot in the chat, and I'm not reading it because I can't listen and read at the same time. But I do want to make sure that logistically, will all of that be captured in our notes, even if not all these people have a chance? Okay, thank you. I just want to make sure those voices are included.
And I did have one more question.
Yeah, is there a way, Amy, Casey, April, that because I assume the people that are here that are public members that are asking the questions are social workers, is there a way in which they get their questions answered, if not today? Yeah, what's the mechanism for them to ask those questions? If they are specific about like this legislative concept, is there a way for them, or the House bill, is there a way for them to share their concerns with the governor's office?
Absolutely. I mean, do you mean beyond, like with notes here of what we've gathered
Yeah.
and?
Yeah, I just was hoping, if their questions don't get answered today, like how do they, if they're directed towards the governor's office, how they do that.
Sure,
Thanks,
yeah.
Amy.
I mean, so as you have access to us, Amy just shared her email here too, but we also want, if there's something that you want to collaborate on to compile questions and then maybe reach out to your constituents for more, and then be able to compile that for us. But otherwise, we're happy to get things directly or hear from you all. Ray and I meet regularly. Amy and I have talked about setting up a meeting as well regularly, and then, but being able to get feedback quickly. You can also just, I'm assuming Amy Baker, by sharing your email here, you're opening to. Okay, great.
Thanks, Amy.
Sure.
Okay, I'm trying to be mindful of time, and I get that there's a lot of public members. We're not so used to getting lots and lots of public members, so we're super excited about it. But I see that there's definitely folks online with their hand up, and then I also see that there are some folks in person. And so I want to make sure that we capture, if we could limit public comment to 2 minutes, hopefully that will give folks the opportunity to state what they needed to state. We may not be able to get to answers, but at least we will have your name, your comment, and whoever needs to provide the answer could.
So Amy, do you mind? Oh, go ahead. I'm sorry.
Nope, go ahead, Ray.
Do you mind if we start with those in the room when you're ready to go to public comment? If we start with those in the room in honor, they have their travel.
Sure enough.
And I guess just let us know when you're ready to go to public
room.
comment. Okay. Oh.
Yeah, I see your hand. Would you be willing to introduce yourself?
Yeah, hi. My name is Jennifer Wells, and I am an LCSW, and I have proudly been so for over a decade. I will say that as someone who interacts with the board on a frequent manner, I have seen a tremendous improvement in the response time and the processing of applications. And so I really do appreciate the steps I've seen. But I do have a couple questions too. And I can appreciate that we do have a workforce issue in the state. And outside of the administrative barriers, I think there's some pretty real economic barriers for people operating in the state. So along with this bill being proposed, there was a bill that was proposed last year, or a movement that was made to not allow associates to operate outside of a CMHP, which was supposed to fix the workforce crisis. And it doesn't seem to be fixed. But I guess that's a different issue. One thing I had a question about was if we're looking at moving the Board of Social Work under the regulatory body of the MHRA and taking the administrative staff to help process them through, what discipline specific person would we have on that to represent social work? Because social work itself is a completely different field. While we are very similar in practice, but our ethics, our morals, and the way that we do discipline and the way that we operate is different. So I can appreciate trying to do that. And I'm wondering why that the solution is going under the MHRA versus looking at increasing the staff, or maybe even modifying some of the current processes we have in place that might make it easier for the staff that we do have to be able to process these applications. Thank you.
Thank you, Jen. Okay. Either of you want to go? Good. Good. Okay. Do you have public comment?
I have.
Okay. All right. And then if you're comfortable, state your name, please.
Yes.
Okay.
My name's Kathy Outland. I'm a licensed clinical social worker. I also have about 19 years of experience serving as a board member on the board of Board of Social Work. And I am really concerned about this idea of targeting the Board of Social Work when there are other boards that provide healthcare. We are not providing. I sense that we are being targeted. What about talking about psychology board and the LPC board? And why are their barriers, which are patterned very much like ours, being even discussed? We are like being singled out, and it feels very targeted.
Thank you, Heather.
Thanks, Jennifer. Thanks, Kathy. There's another public member. Did you want to make a
Yes.
comment?
Yeah, it looks like Carrie was the next person to have a hand raised.
Okay, I just didn't know there was another person that was there.
Yeah, Carrie and, oh, no, he didn't. Did you want to do a
Okay.
couple with him?
Yeah.
Okay, oh, I'm sorry, go ahead. I apologize.
The only thing,
Oh,
my name is
well,
Nathan,
Nathan?
social worker as well for the past decade, colleague of Jennifer. The only thing I have noticed is in the other states where they have combined all these departments into one, I have yet to see any of them become more efficient, having done so. Thank you.
Thank you, Nathan.
Thank you, Nathan. Online, I see Carrie.
Hi, I'm Carrie Stepnick. I have been involved in social services since 2006. I have been a social worker since 2017, and I do currently hold my CSWA. Just because of personal circumstance, I have not done my clinical exams. To be honest with you, I'm lucky to be alive, and just because of medical issues. And I just want the board to know how much I appreciate all of you for standing up for us. And I appreciate the fact, and the reason why I took so long to go for my master's degree in social work was because I wanted to make sure I was making the right choice for myself. And the reason I went for my MSW was because of the uniqueness of the social work degree. And I made that right choice. And there's a reason why we need to stand unique in our field. And we should not be shoved into an umbrella underneath another organization. And that's how I feel like you guys are targeting us. We have our own code of ethics. We have our own operational guidelines. We have our own board.
You have about 30 more seconds.
Okay, my question is, what's going to happen to our board? What's going to happen to our people, our administration that takes care of us? Because without my board and my administration in social work, I would not have remained in the field. Thank you.
Thank you, Carrie.
Lacey?
Yeah, it's hard to know where to start because this is all new information. I'm going to try to keep it short and sweet. I am wondering two things. This bill is saying that it's going to help providers, but it feels like providers are not consulted in what's actually helpful. When I look at the bill being in private practice, I've worked in many different sectors. This bill doesn't actually support me in what I actually need. And I think it's frustrating, or I feel frustrated. I will use my own feelings. I feel frustrated not being consulted and having my board possibly taken away because we think it's going to be better, but we don't have data to say that it's going to be better. And to just hear about it now is also frustrating. I had to move appointments around. That's a financial hit, but I think it is important enough to attend this meeting. And so if there's this much thought around us being combined, is this bill going to be pushed forward no matter what? Or can there be a pause on the bill and actually talk with your people that are practicing in the community and what they want? Because it also sounds like our board is not in support. And so it kind of feels like we're steamrolling. So I wonder, is this bill still going to push forward, or is there going to be a pause so that we can actually talk to who this affects?
Thank you, Lacey.
Thanks, Lacey. Josh?
Can you guys hear me okay?
Yes.
So my full name is Robert Josh Leiden. I'm an LCSW CEO of Stronger Oregon, and we have about 100 social workers working for us right now throughout the state. My relationship with the state has been tumultuous, to say it lightly. There's been a lot of non-communication in so many things. And so this is another example, echoed by what Nicole said too, where it just becomes a legislative concept already in motion, and now you have to fight at the same hill to try to change the direction of this. There's a lot of misunderstanding. I think even still within this room, I understand the state is actually trying to just park it under there, not necessarily to get rid of the board, get rid of the the laws within it. It's just like new administrative management. And so I think that everybody's walking in here thinking like the whole thing is going to be obliterated, and some are still feeling that way. And so there's an inherent mistrust, even if it is a light level intervention at that level, of one aspect of this legislative concept, of anything that comes out of the governor's office or any of these three governing bodies that have been made up by hand picked individuals. And I think it goes back to even just the mistrust around taking away associates' ability to render Medicaid services as well, with forcing them into certificate of agreement organizations, which is immensely administratively burdensome. We anticipate 9 months just to actually get that certification, if that is actually still going to happen, which is unknown. They're supposed to be doing a lot of things, and it's supposed to manifest in June. And so I'll conclude just saying that the governor and the legislative body needs to become more transparent, more engaging of the social work community, to actually consider what we actually need, as opposed to what small groups of people close to the governor make up. Thank you.
Thank you, Josh.
Thank you. Any other public comment, board? Nicole, did you still have comment?
Yeah, I just wanted a couple comments so that they go on the record. So one is I'd like to see, I kind of want to know some evidence that demonstrates that composite boards produce better outcomes and public protection. I can tell you, as somebody who employs people in the behavioral health field and has had to work with composite boards, that it hasn't always been the greatest. And then my other question is that I had heard somewhere that this was going to be a zero cost line item. And so I think the state proposed that consolidating the Board of Licensed Social Worker would have no cost. And what I'm curious is how that was determined, because given administrative, IT, staffing, rule alignment, and just like the typical work that's required of transitioning something on like this on a scale, I really want to know how they can explain that this is going to be zero cost.
Olivia.
I just also wanted to add something for our record today of why is there a shortage of people? Like, why are so many people needing services? And this seems like the most like downstream intervention. And we need people are in crisis because they don't have food. They don't feel safe in their communities. They don't have like a place to live. And so like housing is so like, right, like those are the things that contribute up here to why people are in crisis. And like there are not enough people to like work with those folks and to support them. And so I just also want to name that this seems like a really, really very far downstream intervention for something that could be addressed higher up by the governor's office.
Yeah, Molly. Thank you, Olivia.
I guess I'm watching the time and seeing we're at 10:01, and I know many of us, including myself, are probably now late for our 10 o'clocks because most of us stepped away from work and rearranged our schedules to be here for this. It's important, but I also want to acknowledge that where the governor's office staff, this is part of their regular day, and the rest of us have taken time away, some at financial burden as well. So I just want to kind of summarize, I guess, what I heard at the beginning was this feedback is solely being taken in as implementation, that there is no intention to adjust the current language in this bill, that it's moving forward as it is. And if I'm correct in that understanding, I guess I want to just put it in public record that I look forward to taking more time off work to testify against this bill if it stays as it is written, specific to the social work pieces. And as much of a burden that is on many of the folks here, I hope that they find ways to utilize their voice and reach out to their representatives. This is not the only place that you can provide feedback. And so I just want to encourage people both around what will work for them and what doesn't work for them. And there was a lot in the chat I know about issues around insurance, more so than the board functioning, and lots of examples of how we are actually functioning more efficiently than other boards, both outside the state and within the state. So I guess I just wanted to make sure that I heard correctly, that the feedback that we are offering is not about adjusting wording in the bill. It is simply about the implementation.
Well, and just to respond to that, Molly, I mean, obviously, we appreciate everybody taking the opportunity to provide feedback. This has been really helpful, and we'll obviously go back and have a conversation about it. You know, your feedback is not feedback that we're gonna just disregard. But obviously, you know, this is a conversation that we would, you know, there's more to be discussed in this, and we're, like I said earlier, we're happy to come back at the next board meeting if that would be helpful.
I just have one more question. I'm sorry, just given the short timeline of this short session, what kind of timeline are we looking at for introduction and making changes? Because we have, what, 35 days? Is that how long this session lasts?
So yeah, the short session is taking place over the month of February. And so because the session has not begun, the bill has not been posted, nothing has been scheduled yet. But I do think in terms of like legislative engagement, just keep an eye on OLIS, which is the legislative website, Oregon Legislative Information Service. If you Google that, once the bill is posted, it'll have all the information about dates that things are going to be heard and everything like that. And as that information comes up, it'll be posted there.
Thanks. Thank you, Casey. It's a good reminder that one of our core values is to advocate for our profession. So that's what we do as social workers, right? We advocate for people, but we also advocate for our profession. So I just really appreciate. Molly, did you raise your hand again?
I just want to encourage all of the public members who are here, or anyone from the public who are here, if they have concerns, to also be talking to their colleagues and their friends as well. Because the more voices are the better. And in case the governor's office isn't hearing me, like, I'm very committed to rallying people to address this issue. And comments today for me were not scripted, and they will be scripted then if this goes any further as is in terms of my testimony. And so I'm going to do everything I can to get as many people as possible to use their voices to address this issue.
Yes. Josh? Oh. Well, it is 10:05. We got through a lot of stuff very, very, very quickly, and I just really appreciate the governor's office coming and sharing. Also, love the public turnout. Would love to have public turnout like this to all of our board meetings, because we really want to hear what other social workers are thinking, but also we love public input so that we can do better work as far as the board goes. So I would like to conclude the meeting at 10:06 and invite you all to our next board meeting, which is February 20th. Okay.
Thank you all for
Thank you all for being here.
Thanks for allowing us to present.
Yep. Thank you, Amy.
Thank you for coming, Governor's office.
Thank you for coming, you guys.
Yeah, thank you.
welcome.
Good.
I would miss it for the world.
Have my help.
Kathy.
Just checking to see if you need anything.
No.
Oh, I'm just
Oh,
really
thank you.
happy that
Thank you.
public came in person. So thank you so much.
No, it's welcome.
Carrie Nate and I went to school together, actually.
Oh, wow.